contributions. I myself have been on a care package for the last 28 years, and during the last 4 years, it's never been more difficult to recruit staff. And this is what you're hearing all the time. We've heard some really inspirational stories, and sometimes I have to admit, it's been very sad, but well done to the team. I think we've done a great job, and I very much look forward to the report going out there and see what happens.
Thank you, Anne. Nadia, could we come to you, please?
I'm Nadia. It is lovely to meet you all. I have direct payment for 22 years. I have an amazing personal assistant team. I feel happy, but it is really challenging my life. I enjoyed my work with my mum, Pippa and Anne. Thank you for the opportunity to share my experience.
Thank you, Nadia. It's been wonderful having you on the team. Katie, quick reflections from you.
Yeah, Pippa, thank you. A huge thanks firstly to Pippa for being the glue of these workshops and holding it all together and answering so many emails and contacting the speakers, and everything's been done on such a personal level. So it wouldn't have happened without Pippa and all her admin and facilitation skills. My reflection is I have been bowled over by all these sessions, and each one has brought something very special. And each one we've had disabled people working alongside and contributing alongside parent carers and family members. And I think that for me has been very, very special to bring organisations and disabled-led organisations together with parent carers and family members. Been so impressed by each of the speakers and everybody's contributions in the chat or when they've come off speaker. And it's just been, we couldn't have planned this to happen in the way that it has done. So it's been very organic and very fluid, and somehow it's worked. And I am feeling quite sad as well that this is the last one in this series. But looking forward to having some action from today, Pippa, as well.
Thank you, Katie. Yes, today is all about action. When we say action, it's easy to think, oh, it's got to be huge. Actions can be small. The smallest actions can make a difference. I remember as a young parent, when I first got into this world, that my friends and I would sit and talk about, we want to change the world, and then we realized we couldn't change the world. So we started talking about making ripples. And I still sit with that really comfortably. All of you people here, I know, will be working so hard to get packages for yourselves, for your loved ones, for your families, friends. And sometimes it can feel that we don't get very far. But I promise you that every single thing that you do sends a ripple out into the world, and it will make changes. And it's all our ripples together that can make the bigger change that we're all looking for so desperately. And so without further ado, let's start today's session. We are really lucky and really welcome Philippa Russsell. I'll leave you to introduce yourself, Philippa.
Well, thank you very much for inviting me. Can I ask one of you to share the slides for me? I've got 4, but just to introduce myself, I'm first and foremost a carer of Simon, who is now 58 and who has his own home with support. Like a lot of people, the dream that we had is becoming increasingly difficult to sustain because of the lack of support, problems in recruiting PAs, etc. But we struggle on. And there are some new resources out there, some community organisations and others to inspire us. But just to go back to the introductions, I think the biggest difference that anybody and anything has made to me have been other people like myself, whether they're carers or people needing care and support, who have formed and still form, I think, a movement for change. And I absolutely agree with Pippa, because years ago, my wonderful paediatrician said to me when my son was diagnosed, and I'm old enough and he was old enough to be offered a place in a long stay hospital. We were told to go off and get on with our lives. And Professor Ronnie McKeith said to me, your son can still have a life and so can you. And he used your words, Pippa. He said, you can't change the world overnight, but you can actually create the ripples that in the end create the stream that creates the river. Everything you do, he said, can make a difference if you want it to. And he also reminded me that the professionals, the doctors, the social workers, other people out there, he said, they're your allies if you listen to them. If you listen to them, they'll listen to you. And I think that's the first time I heard the word co-production. So anyway, launching my presentation. There was one slide before this, actually. This is the second slide. It doesn't matter if you can't go back. Oh, thanks. So the impact of social care and sharing our stories and planning for a better future. And we're in very odd times, aren't we? Because who knows what's going to happen with the present government and present leadership and what comes next. We have the white paper, we have an agenda in theory, in capital letters, but not in any detail about social care reform. But we have to assume that we've got an opportunity to share our stories, and the stories make the future. Our stories are the ripples. So just a reminder that across the United Kingdom, there are 9.1 million unpaid carers. I'm talking about carers in my presentation, but I'm not in any way leaving out the people whom we actually live with, love and support. It's just that I'm starting with carers. We're all part of the same family. There are about 4.6 million carers in the United Kingdom, but Carers UK in a press release today, it's Carers Week, and I apologise, I will have to vanish by 12:15 because we have a big live meeting across the southeast coming up, and I have to be on time. But the numbers of unpaid carers are growing because we know that the support that many people might have expected is simply not there. The latest Carers UK survey, to be published today, too late to be included in this presentation, suggests that the numbers of unpaid carers who are now caring over 50 hours a week has more than doubled since 2020. Now, if we're a carer, we want to care, but my son is an adult. He doesn't always want his mum running around after him. He would actually like more self-directed care and support. And so if we talk about unpaid carers doing more, it may well be that the person they're supporting is not doing the things with the people that he or she would have liked to have done to get on with their own life. So if we've got 81% of carers providing more care since the pandemic anyway, 60% worried about the future. This is the big Carers UK surveys. 68% saying now that they have problems with their mental and physical health. Anxiety, I think, about the future for most of us. But 75% very worried about their financial future. And I worry terribly about Simon's financial future because it's actually interesting reflection, as his consultant cardiologist said to me. Simon is part of the first generation of people with learning and other disabilities who actually will outlive their parents. And that's good news. But actually, Simon's going to become an older person. And are our services for older people fit for what he wants and he will need? I think we will have to make a lot of ripples and hope that the stream gets big very quickly. But we have the Care Act 2014, and a number of us are becoming activists to actually reactivate the Care Act after the Coronavirus Act, because the Coronavirus Act enabled local authorities not to carry out assessments, not to provide the same quality of service. Of course, they couldn't because of COVID. But the fact is the aftermath of the coronavirus Act lives on. And the White Paper's aspiration to ensure that disabled people of all ages and those who support them have the opportunity to live full and happy lives in their communities is something which the Care Act really enshrined as a principle. And we've got to put that back in. I mean, I worry that social care is becoming much more what it was with the original welfare state in 1948, a crisis service, not a service which enables people to have good lives, but a service which avoids us falling through the holes in the welfare net, which is how Beveridge actually wanted his welfare reforms to stop feeding through the gaps. And those of you interested in history, because William Beveridge is the architect of our NHS, he was asked just before he died in 1959, why did you never think about social work and social care? Because the reforms initially were all about health. And he said, when I first thought about the welfare state, I was thinking about people's survival. We'd come through a war, there was a TB epidemic, a lot of the infrastructure of the country was destroyed, the whole world was very uncertain. But he said, we got the 1944 Education Act. It was the first act that gave disabled children and young people any right to education. And he said, I thought if I started with health, if people were physically fit, then we could begin to look at quality of life. But he said, somehow or another, we never got to that point. And it's an interesting point, and it probably explains why, if you talk to the great British public, most of them will talk about the NHS and not about social care. There was a House of Lords committee at the moment. It's now finished taking written evidence, but it's on adult social care. And their big ambition is to lift the veil, they say, on the invisibility of social care, what it really means, what we need to live ordinary lives, and how we can put it back in the government and the great British people's thinking about something which is integral to all our lives, and it's just not for people who can't cope. So we've got to generate that public debate on social care, and those who use it, those who work in it. And a friend who's disabled said to me the other day, one of the big challenges about social care is that when it works well, it's very personal and private. You don't have to go out to hospitals. You don't have to go out to big places. And it's the hospital which symbolises health and care to a lot of our ordinary population. And she said to me quite rightly, and it's really been the message of these wonderful workshops, we need to share our stories, and the good stories as well, because so often, if you look at something coming up on television news, social media, it's when things have gone terribly wrong, and we need to understand that. But equally, we need to celebrate and show that people can have ordinary lives and it's worthwhile. Next slide, please.
Sorry, just while there's a little break, Philippa, is there any chance you could just slow down a little bit? Just that me and Charlotte are really struggling to keep up with you.
Sorry,
it's okay, because obviously you know your information, but we are really struggling to keep up with you right now.
I'll slow down. I put a lot of text on the slides so that you at least could see what I was talking to.
Yeah, but we can't read and sign at the same time though, and listen to the information. So we just have to listen and sign, unfortunately. I'm
sorry, Nadia and others that I'm
don't worry. Don't worry at all.
So, social care, the invisible public service. I've just talked about the wide public support for and some understanding of our National Health Service. But social care has always been misunderstood, underfunded, seen as crisis related. I think we have a role in working towards seeing parity of esteem between health and social care. And parity of esteem is a curious phrase, but I think it means respecting what health and what social care can deliver and how we can better integrate them. Actually, we all need health and social care. And those of you who are interested in how people write their definitions of health and social care might be interested that the World Health Organization definition of good health includes social care. It talks about physical health and social well-being, which really is what all of us are ambitious for. So I think there is an opportunity for all of us to help with the bigger debate, which surely must come as part of COVID recovery, to rethink social care in the same way that we understand public health. Now, you may wonder, why am I talking about public health and the NHS almost as if they are separate? But a lot of people see the NHS as people who are sick, who need emergency treatment, who go to the A&E department, who wait a very long time to see a consultant because something has gone wrong. We all love our hospitals. Most communities raise money for them. They don't raise money for community services or social care. And when I talk about public health is part of the NHS, but it's often treated as something separate. And public health is about keeping people well. It's about supporting them to live well in their communities. And it's about well-being. And well-being is what the Care Act, of course, introduced as a principle. And many of us were very glad to see well-being in, but we don't hear well-being talked about much in the current public debate. But our own well-being is something which we together have to argue for, and we need social care just as much as we need health. Now, what about a COVID recovery? The white paper on social care reform offers what it calls a 10-year action plan for social care. But we have to be honest, the war in Ukraine and what it's going to cost long term, and the general threats to the economy and the rise in the cost of living mean that we really will have to speak up. But I'm encouraged because, as a former historian, I know that sometimes the best things have happened when we haven't got enough money. If you haven't got enough money, you can't build big institutions for disabled or older people. If you haven't got enough money, you have to look to the community and other ways of actually providing support. And if you haven't got enough money, you have to rely more on the community to find its own solutions. Now, Japan, interestingly, has a big public reform agenda when they are asking disabled people and people who care and older people exactly these questions, and thinking about the ripples in the stream that becomes a river. They are asking, what could we do today, now, with the resources we have? What could we do with a bit more resource, a bit more creativity tomorrow? And what do we actually want longer term? Because you won't get the 10-year action plan without actually starting now. And I think we need what the Germans have had. I don't think everything is wonderful in Europe, but the Germans really reformed their health and social care system. And they went to the people and they had what they called big conversations. And those big conversations were not only how do we pay for care if people need care, but what care do we actually want? And what is the responsibility of the state, the community or the local authority, and individuals themselves? And I have to say that the big conversation was very difficult. Not all the Germans agreed to begin with. Some of them were very angry, as people here have been angry at increasing our national insurance contributions. But in the end, they reached an agreement. And things are not perfect, but there is an understanding about how health and social care and the community and individuals put together like a jigsaw. And people are very clear what their rights are and what their roles and responsibilities are. In the United Kingdom, we don't really have clear guidance on what the responsibilities of the family as a whole are. And I don't think that we've gone far enough with the human rights of people who need services and support. But the Germans have moved, by having this conversation, have also moved a lot of their care into the community. They had a lot of institutional care. Some of it was very high quality, but it was institution. But they had the conversations. And I would have liked, with our white paper, for the government to have gone out and had those conversations in parallel. We have new money promised for carers, for innovations in housing, to develop the care workforce, but we haven't done anything, have we? And I have to say that in Germany and Belgium, which I know well because I've lived there, carers, whether they're personal assistants, support workers, care workers in a care home, are better paid and they are much more highly regarded. To work in social care is as good in the public eyes as working in the health service. And I don't think we've got there in this country, have we? I mean, a report is coming out very soon from TLAP, produced with the local government association, looking at the problems in recruiting PAs in many parts of the country. Certainly down here where I am now, it is exceedingly difficult to recruit a PA or a support worker. And we have to ask ourselves, why are people not coming? It's not only money. Why are people not coming forward to do some of the most rewarding jobs? My Danish cousins tell me that they're opting to work as a personal assistant or a support worker of social care is a valued profession, that people see it as an occupation where you can be really dynamic, creative, and there are career opportunities. The white paper wants us to develop those career pathways, wants us to change attitudes, expectations for our workforce. But I think we will have to do a lot of pushing for it to happen because of the economy. And when one of my son's occasional support workers tells me that they are going to work at Aldi because actually they're being offered 20% more money, my heart sinks. And I can't offer 20% more money. I'd like to, but here's somebody good going off to a job that they don't really want to do because it's not sustainable for them to stay working where they want to. So next slide, please. So the big ambition, and I think we have Anna coming up from Social Care Futures. I'm sorry, I missed the S off. So the big ambition is that we all want to live in a place we call home with the people and things we love, in communities where we look out for each other, doing things that matter to us. And social care, if it's done well, if it's co-produced with the community and people it serves, can actually make that happen. I think the white paper does actually take us in this direction. The white paper is written in language which is very different to the usual government white papers. But we haven't had any more discussion about it, have we? It was published. We know that next year, the way in which we pay for care, particularly going into a care home, will change. We will have care accounts, but I want a much bigger debate about what the care is that we're going to be contributing to, and actually how a lot of people will be able to afford it anyway. So let's get back to the Care Act to achieve that big ambition, and putting the well-being back into social care assessments. And I'd like just to say a few things about assessments, because I think post-COVID, assessments have become crisis-driven. I don't know how many of you on this webinar have actually had a proper conversation or an assessment with a social worker over the last couple of years. I don't blame my local social care workforce. They are short-staffed, they are under massive pressure. I'm not in crisis, but my son actually is changing. His needs have increased. He's much living where he's living at the moment for very much longer. Even with a great deal of money, his little house can't be made fully accessible. And I would really like an assessment, which was a conversation for both of us, where we could actually sit down, where we could think through what we actually wanted for the future. And the Care Act saw assessments like that. They were a dialogue, they were personalised, and the care and support plan, if it resulted, was personalised too. So I think we have to find a way of helping local authorities recreate those meaningful assessments. And I felt very sad when my only correspondence contact with Simon's social worker in the last 2.5 years has been a very large bill for the charges which he is expected to pay to contribute to the cost of his care. And the arguments about disability-related expenses, which local authorities have had to take into account. Well, we've already had some discussion on that, but I think we have to have a lot more if people are to have the lives that they want to live. And so just to sort of end up on and contribute to the discussion, I think we need to help create a new narrative for care and support. And I think the financial pressures have driven that debate backwards to some extent, because some families are so desperate that they are in crisis, and we need to help them in crisis. But we also need to look at the wider picture. What is the pathway to the future? What do we want by social care? And how do we actually measure its impact? Somebody said to one of the House of Lords Committee on Adult Social Care that good social care was so private that people often didn't know it was happening. But because they don't know it was happening, it's not necessarily appreciated or valued or understood by the wider world. And that's where I think peer support matters, because we can share good and bad support in our journeys. And I'm delighted, Katie, that you've actually got a live meeting in Leeds coming up, because I really think we need to actually be able to get together with real people again. It's a lovely, lovely meeting like this, but we also need outside that to have our own satellites. The other thing that I think we really need to reinvent, it's in the Care Act, but was right at the very end of the Care Act's development, is advocacy. I think a lot of people, carers and people needing care and support, need advocacy. They need advocacy to help them clear their own minds about what it is they really want. They need advocacy to actually get it. But could we be advocates for social care? For example, within the new health and care bill and the proposals around integration, there are real opportunities with the ICSs, the integrated care and support systems. And one or two that I've looked at are really endeavouring to co-produce a new integrated health and care system with their local communities. But others, I think, have a long way to go. And some, I think, have no local track record in really working with people like ourselves in a creative way. It's not that they don't want to. I think we have some lessons to share, lessons to learn, and that we have to push the door. And then we have to understand ourselves what the impact of care, whether we receive it or whether we give it, what the impact is on our mental and physical health and well-being. And not having the right care can be really humiliating, can't it? It can destroy people's sense of confidence and independence. If you're a carer, not being able to give your relative everything, or friend, everything that he or she needs is very, very, very hard. So we have to understand and be kind to ourselves. And that's where I think the friendships and community and co-production that these workshops have demonstrated are so important. And finally, making it real. I was delighted that the I and we statements ran through the white paper. The white paper wasn't full when it talked about social care reform of the usual comments about the government will or this, that, and the other. It was much more the I and the we, what I and we want, what I and we might contribute, and how partnership and solidarity in the end really matter. So social care reform is coming, we hope. It's anybody's guess. I don't know what will happen if Boris doesn't survive as leader. I mean, who actually would be the next prime minister? Who would be responsible for health and social care? I don't think it's a good thing for a government when it's limping along with internal arguments. It's nothing to do with party politics. It's just the way things are. On the other hand, I'll just finish by saying there's the old saying that nature abhors a vacuum. And if actually there is a lot of turbulence and a lot more debate in local constituencies about what they want from the government, well, maybe we have an opportunity. There certainly are government ministers who do want social care reform to work well. But my big fear is that social care reform might end up being seen as yet another argument about the cost of care homes. And actually, social care is about our ordinary everyday lives. Care homes are part of the environment, but they're not what so many people think. What is social care's prime purpose? So thank you for involving me in these workshops. I think they're really important. I think the report will be important. And I think we have to stand up for our social care allies. When I said I hadn't had contact officially with Simon, social worker, in the usual way, I've spoken to a couple of local social workers recently. And when I hear the distress and despair that they are feeling because they cannot actually offer what they know the people they're trying to support need, I realize that we've all got to be much more open and honest. Times are tough, but solidarity has worked in the past and it can work in the future. Thank you.
Philippa, thank you so much. I really appreciate all your input. There is so much in the chat of people agreeing with what you've said, picking up certain points, and just appreciating your presence and your contribution. So thank you, big thank you. We know you have to leave early, Philippa.
I
We will
apologize.
be in touch.
Could I make one last comment, which I meant
Please
to
do.
make? There's going to be a lot of debate coming up about what is the evidence for any proposals, what actually works for social care. I think we have a huge body of evidence individually and collectively, and we have to get very smart about actually using it. And actually, this comment was made to me by an ADAS, Association of Directors of Adult Social Care Services, to me at an event sort of a couple of months ago. And he said, we will need evidence to justify the fight that's going to come for survival in terms of how budgets are allocated locally, nationally. We actually need to be able to argue for the people we want to support. So you actually have a role in sharing with us what you know, what works well as what the problems are. And I think these workshops are evidence which we actually will need to share and use in the future. Just a final thought. I mean, not only is it important that we work together, but we have something very important to offer. What happens next with social care reform?
Thank you, Philippa. Before we move on, I just want to check with Gemma and Charlotte. Do you need a few minutes break? They are our interpreters. Before we move on to your presentation, Anna, could we just hear from Gemma as to whether a break would be welcome?
I'm okay for a bit longer if you want to do the next presentation and then have a break.
Okay, that's fine. Thanks, Gemma. So let's go straight on to Anna. I will leave you to introduce yourself, Anna. I can't see you on the screen at the minute.
I'm here. Hopefully, if I speak, you'll be able to.
Yeah.
I might appear. I'm hoping that I can share my screen. Oh, can somebody make me a co-host or something so that I'm able to share my screen? Thank you. Yeah, thanks for having me. It's lovely to be with you today. I've had a bit of technical issues this morning, and there's a very loud drill outside my house. So apologies if you can hear any background noise. I'm Anna Severwright. I've been drawing on social care for 10 years now. And as I'm a disabled adult, and I employ personal assistants in my own home. I'm currently in the I'm sure familiar circumstance of trying to recruit new PAs and how tricky that is at the moment. Right, let me try and share my screen now. I think, there we go. So hopefully you can see that now. If I'm talking too fast or something goes wrong, please just wave or shout at me. I'm also one of the conveners of a movement called Social Care Future. And I'm not sure I should admit this, but I'm also a special advisor to that House of Lords committee that Philippa was referring to. And so I'm doing my best to try and influence that in the way that perhaps move away from some of the traditional thinking and to the more ways that we talk about social care and about people's lives. I will add links to my slides and then send them around next week if that's helpful, so don't feel you need to write it all down, or I will go over some slides quite quickly because I kind of want to go through how we've got to where we are before we can get on to what next. But I think it's really important that we focus on what's next, what can we all do, and kind of a bit of hope really, because I think there is optimism to be had. Well, I always feel there is, there's always something to try, and I think we can make a difference. So Social Care Future, we started about 3.5 years ago, really as a bit of a protest. There was a large conference happening that we had argued that people with lived experience should be speaking at and attending. And it was said to me, this is not a conference for people with lived experience. And we felt that was wrong. So we held our own event over the road in Manchester. Many of you, or some of you, I think, were at that event. And from that, I think there was a sense that actually we did need a space to come together to discuss what we thought about social care. And really, we are not a movement. We are just, we are a movement. We're not an organisation. So we don't have a formal structure. We don't have staff or anything like that. We're just about people coming together, but all people, everybody is welcome. People who draw on social care, family carers, people who work in social care, people who are senior, I don't know, directors, anybody can come, and it's for us all to be together rather than having a space over there for directors, a space over here for people who draw on care, space there for carers. We all come together, and I think we're more powerful when we do that. And we wanted to talk about people's lives, bring the conversation back to real people. And we wanted to be ambitious and say, actually, this isn't good enough. We want change. And as Philippa read out our vision earlier, this was one of the first things we did. We co-produced this vision. It's very simple, deliberately. It's about the things everybody wants in our lives. It's not about disabled people. It's not about care and support. It's about lives. And there is a longer version that on our website that kind of puts some structure behind it. But actually this vision is the key. And this has been taken up, and it changes the conversation from beds and commissioning to people's lives and the difference that social care should be making in our lives. So one of the first things we sort of tried to do was to change the story, the way people talked about social care, from this kind of life and limb 15-minute visits to having a life, from talking about people being in social care to actually social care just being a tool that enables us to live our lives. Stop talking about people as vulnerable, but talking about us all as having our own value and capacity. And we did some research on that. Again, it's on our website, but how we talk about social care is so important. And the sector was just talking about a crisis all the time. And then we tried to build a movement. We've had gatherings, we've had events. Some of you will have been involved in some of those things. And anybody can be a part of Social Care Future. You don't have to sign up to anything. You can get our emails, but you know, it's a very broad movement with the hope that if we come together, we can make change. Another thing we really tried to do was offer solutions. We didn't just want to say, this is not good enough, this is terrible. We wanted to say that, but then say, but here are some people that are doing some really good things despite the current system, despite the funding. Draw attention to those things and try and encourage other areas to use some of those approaches, to share the learning from those things and to offer some solutions, so that we weren't just saying, you must do better, but we were then saying, here are some ideas how you could do better, that we know work for people in different parts of the country or different places. The final sort of big thing I suppose we did was a thing called the inquiry, called Whose Care Is It Anyway? Because actually I think the sector often thinks that they own social care, but actually surely it's about all of us and our lives. Partly to offer those solutions. To rebalance the power, we led this inquiry, and that was key. We set it up, we started it, we did the whole thing, and we called other people to us. And we were trying to show, actually, people who draw on social care can do this too. We don't need you to do all these things for us. We wanted to be heard, and we wanted to shape Social Care Future's work going forward. The group of people who led the inquiry, all ourselves or our family members, draw on social care. And we published a short report last year. Again, you can find that report or the easy read version on the website. And really at the heart of it, we heard from so many people, like you've all been saying at your events, you know, the fight, the fear, the lack of choice. But we also heard really different things to what the sort of other commissions and committees come out with. We heard that these 5 key things, you know, people wanted to feel part of the community, wanted to be able to choose where and who they lived with, wanted to lead the lives they wanted. We do need more money, but we wanted it used on the things we wanted, and we wanted to share, have genuine power shared, rather than be told what to do or feel that sense that of fear and fight. And I mean, talking about ripples, that I've loved hearing that. I heard just before I came to this meeting and another meeting that a council are now, one council have now using these 5 key changes as to develop all of their strategy for social care. So some of these things that we think, oh, it's a small thing here, it's a small thing there, they do have impact. And even just talking in different ways and sharing your experience in a meeting, you might not know, but that will have impacted a professional who might go away and change their practice, and that then influences other people. So we came out with these 5 key changes that we as Social Care Future think are a good step forward, or would be a good step forward if they changed. But kind of, I suppose, where I want to now go to is where next for us as Social Care Future, but for everyone. Like, I think, what are we focusing on, and how can you be involved, and how do we all need to kind of keep going with the fight? Because unfortunately, we know that many people are still not experiencing, certainly not an equal life, or the life that they would want to live. So this short briefing document, again, it's on the website, and an easy read version came out last month or 2 months ago. And we're really focusing on 3 things now: reshaping expectations and imagination. Sorry for all the long words. Building people power, and what we're calling disruptive innovation and systemic change. So the first one, reshaping expectations and imagination, and Philippa talked about this. Actually, people do not understand social care. And when it's on the media, you usually get this picture, what I call the wrinkly hands picture, or they talk about care homes and elderly people, which is a really important part of social care, but it is not the whole story. And they use those words like looking after our most vulnerable, people being in social care. So we think that the only way to really get some big change is to build awareness in the public, but also a real sense that this is about all of us. And that in that way, we hope that would then put political pressure to actually do some of the reform that we would want to see. So we want to talk about people's lives, we want to talk about well-being, we want to say that actually we all have a right to these lives, and we're all important parts of society, and some of us will need different support at different times in our lives, but that's about the greater all of us. And so we've just got a little bit of funding to start scoping out a campaign. We're looking to people like Australia, where they did Every Australian Counts, and that had a big shift in culture and way of thinking and spending on for people with disabilities. So we're hoping that we can start to talk to the wider public and get their support on this, that actually we all deserve the lives we want to live, we should all have choices over those lives, and that social care impacts all of us and is a real asset to society, as are disabled people and people later in their lives. The Building People Power one, this has a few different sort of elements to it for us. In meetings and conferences, we have this thing now called the pledge that certain quite senior people have taken, and they refuse to speak at conferences now if people with who draw on social care are not also speaking at those conferences and represented in the audiences. And they have turned down some conferences. We're also working with TLAP around some guidance for conference organisers about how to better involve people, and building a pool of speakers and people who are willing to speak on certain topics or at certain events, so that we can better match up. Because what usually happens is we challenge a conference that has nobody who draws on social care speaking, and then they say, oh, you're right, can you find us somebody? So we're wanting to kind of develop some way of having a wider range of voices that are heard, and also developing people's skills to speak at these things and confidence. There's a course that's called Partners in Policy Making that you can apply. It's free, it's online, starting in autumn, that will hopefully help, again, give people some knowledge and skills for how to influence change. We're having gatherings. We're working with lots of different places, Access Social Care, on how people can challenge decisions. And I know you've been doing a lot on that. And I think it's about building people's power to influence the big change, but also to influence local change in their own lives and the local system around them. I also think it's about going beyond sort of co-production, in the sense of you can come in and kind of co-produce a project, or we're going to hear from someone with lived experience, to actually, I really want to see people who draw on social care, family carers, being leaders in this change. I think we have so much to offer, and we should be leading this change as well as being consulted on it or a part of it. And then the next part for us is what we're calling disruptive innovation and systemic change. And in a way, this is the bit that sometimes I think, oh, do we have to? But actually, yes, we really do, because if we don't change some of the more structural things that sometimes sound a bit boring, then actually it makes it a lot harder for local areas to change. So we're doing a few things around this. So we have a group called More Than a Provider, who are part of Social Care Future Movement, and they are providers, but they are looking at how they change, but also can influence other providers. They're holding 3 gatherings this year. If you look on our website, you're welcome, or on our Twitter, you're welcome to come along to one of those. We as Social Care Future meet fortnightly with the senior leaders from people like CQC, ADAS, LGA. So we're part of that, trying to influence those organisations. Things like the new CQC assurance, it's not the most exciting thing, but if we can get some of these things that matter to us into what councils will be judged on, they're more likely to do it. And it won't be perfect, and we won't get everything we want, but it's about those steps towards what we want. we're starting a community of practice. In fact, that's where I was before this. 23 councils have agreed that they want to move towards our vision and use Making It Real. And we're trying to support them. They're doing it in co-production with citizens, that we're very clear on that. And they are all actually making some real steps towards that. And that for a year, we're going to support those councils to try and move and change how they are delivering services in that area. I think
Anna,
Oh,
sorry to interrupt,
Yeah.
but you have about 2 minutes left.
right, yeah, this is my last but one slide,
Thank
so
you.
I have almost finished.
Thank you.
I think, as Philippa said, most social workers are on our side. And so we're trying to support them as well, the good ones. There are some really good ones doing good things despite the current system. And we're trying to support them to come together and lead change as well in their councils. So my last slide really is, we need you. I think we need everyone. We need people who are going to be the angry voices and saying, this is not good enough. We need people that are going to work with the government and the system, and we need a kind of broad range of people. And there's loads of ways you can get involved with Social Care Future or other things. I will put the links in the slides. You can look at that briefing document. If you're interested in any of the things I've said, just email the Social Care Future email and say, I'd really like to be involved in that. How could I link with that? I think it's going to be really important that we all come together and are quite strong in our voices and united about the lives we want and calling out for that. And that's my contact details. But as I say, I will send around slides. So that's it from me. Thank you very much.
Thank you so much, Anna. We will share those slides with everyone in the next few days or the beginning of next week. I'm going to come very quickly to you, Severwright. You've had your hand up. You've been waiting very patiently there.
Hi. I'm Severwright Patel. I'm a service user. I'm also a parent advocate at local level for other parents who are disabled themselves, but also carers of disabled children. I was just wondering whether you're able to tackle, we've all got hidden disabilities, not visible. We get a lot of barriers and discrimination because of that, because they don't seem to recognize hidden disabilities, but also the cultural and religious needs. I've had to challenge our local authority when they were trying to bully one of my cases to say she's going to get agency staff and it might be a man and she's got to accept it. And then I had to challenge them and say, under the Race Equality Act, you cannot do that. And she has rights, and she can ask for a woman, and she can ask for direct payment. We have got choice and control, but I was just wondering whether you're tackling, the inequality that happens to some of our groups, such as disabled parents of disabled children. We often get put onto child protection unnecessarily. I've had to rescue about 5 different parents, and it's a challenge because the system seems to say that if you're a service user, you can't be a carer, but we are both. Thank you.
Thank you, Severwright. Great questions. Anna, do you want to give a quick response?
I mean, I'll try. I don't think there's an easy answer, but I think a really important point you make about inequalities and that most people are wearing lots of different hats. I don't think we're doing enough on it. We're trying to challenge many of those things. I know Scott, who was on our inquiry group, he had to really fight when he became a parent to, be allowed, it sounds ridiculous, to be allowed with his partner to, raise their daughter. So I would say get in touch with us if you want to work, because I think these are issues we need to be keeping going on. And I don't think we're perfect on it. We try to raise these kind of issues, but yeah, I'm sorry, I don't have a nice, neat answer, but definitely really important points.
Thank you. I would like to work with you actually, because I do think some groups get a lot of inequality and we need to be tackling that. And if you've got like 23 authorities working with you, even if we bring up change in them 23, we're starting somewhere, because this, I think it's a human right abuse for us as parents of disabled children who are disabled. It's our human rights being abused, but also our children, and they never think of us as families. And you get a lot from being a family actually. And some of us are really good positive role models for our children, and they need to see that. Thank you.
Thank you, Sarifa, and thank you, Anna. Thank you, Sarifa, for your questions, your comments, and Anna for your response and the wonderful presentation. Once again, there is lots of appreciation for you and your presentation in the chat. Now I see there's another hand up there, but before we do that, because we're running slightly over time, I just wanted to check, Alex, you are next to speak, and I know you've just joined us because you've rushed from another meeting to this one. Would you be okay if we had a 5-minute break and then came to you, or are you rushing off? That's okay. And is that okay with you, Emma, because you are following Alex? Can't see Emma. Yes, I can see you. Brilliant. And I don't think Dan is here yet. So I suggest, who is this with a question? TM. Okay, I suggest we come back to that. We're going to take a 5-minute break. And we will, it's 7 minutes past 12 now, so we will come back in 5 minutes' time. It's time to go to the toilet, stretch, get a quick drink, have a rest, you interpreters. See you in 5 minutes, everyone. Thank you.